Although tremendous progress has been made, heart disease remains the leading cause of death in both men and women in the United States. However, by simply adopting a healthy lifestyle, you can significantly reduce your risk of heart disease. Research consistently demonstrates that the avoidance of smoking, healthy eating, and regular exercise all have significant impacts on your cardiovascular risk. A cardiovascular physician will join us on this week's Health Talk to provide important tips on improving your heart health. So stay tuned, we're up next. Hello, I'm Dr. Eric Mazer. Today our topic is heart health. Joining me to discuss this very important topic, relevant to us all, is Dr. Harvey Kramer. Dr. Kramer is with Nuvance Health and specializes in cardiology. Dr. Kramer, it's so good to meet you. I know we've been neighbors for all these years, and it's good to finally meet you after all this time.
Thank you. It's a real pleasure to be here.
So we're going to talk about heart health. First of all, I see those graphs that show that cardiac deaths have fallen by 60% or something, age adjusted. But it's still the leading cause of death, isn't it?
Well, it is. I'd love to tell you that cancer isn't catching up, but they're close to each other. But nevertheless, cardiac disease, unfortunately, still remains a growth business.
So you're not looking for patients at this point. There are enough who are already out there.
Unfortunately not. And the American Heart Association several decades ago had a program that they hoped by the turn of the millennium would eliminate heart disease. Unfortunately, that didn't happen, but that's still the dream.
So what are we not doing? We have fabulous drugs out there for lipid management, for managing cardiac rhythms, things like that. What are we not? Smoking has gone down, although I guess there's a lot of progress still to be made in that area. Where do you see the biggest opportunities for improving cardiovascular health?
That's really a great issue that you brought up, because we have fabulous tools, as you're mentioning. Part of the challenge is identifying people who need the tools. We're pretty good at that. But the other part is implementing the tools that we have and the treatments that we have so that people can take full advantage of the science and the treatments that we have. And there's a long way to go in terms of being better at that. For example, within the past couple of weeks, some new information, the NHANES data, which is a national data that the government collects on hypertension, has showed that the number of people who have hypertension is increasing, and the number of people who are being treated and controlled for hypertension is decreasing. So,
is that demographics, or is that because of our diet? Why is that?
Well,
we don't know.
That's a simple question with a complex answer. It has to do with a lot of things. It has to do with demographics. It has to do with the expense of health care, the inconvenience of health care, the expense of medications, the expense of follow-up once you're on medications, the expense of testing, for example, blood tests if you're on certain medications for blood pressure. So it's a combination of those things and human behavior, because at the end of the day, implementing so much of what we know in disease prevention requires a change in behavior. That's hard. Swallowing a pill
I'll talk to that. I struggled with my weight my whole life, and I'm still struggling at age 70. It's a problem.
It's a challenge.
Okay, it's a challenge. So you said that we have, there's so much to talk about here. Let's start with the simple things. I mentioned in the introduction, smoking, exercise, a healthy diet. What are the obstacles to that, other than behavioral ones? I guess we've made a lot of, can we make more progress in smoking? I mean, what are the obstacles to getting further there, to getting further with exercise?
Well, to take smoking, for example, it's still true that about 20% of the population smokes cigarettes. One of the new challenges is that younger people, middle schoolers and high schoolers, are not only smoking some, but they're vaping like crazy. And as you know, we're not so sure that vaping is necessarily safe. In fact, a lot of information suggests that it isn't so safe, and some people who vape later on may segue into smoking cigarettes. So this is a behavioral and educational issue, and something that really has to start very early in people's lives.
Do we understand? I know that it still seems like for some subset of the youthful population that smoking is still cool, and I don't understand it. It's taking a little bit of arsenic every day is not cool, but it's the same, has the same effect on your health. Do we understand that dynamic at all? Is it part of rebellion? Is it part of the the sense that kids think they live forever?
Well, I'm an adult cardiologist, but I'm also the parent of what are now 3 children in their 20s, so they've managed to get through that. But I think it's a behavioral issue, it's a peer pressure issue, it's a looking cool issue, it's a complex issue. And of course, for individuals who have parents at home who smoke, that's really a high-risk marker for individuals who at a young age are going to say, well, if it's good enough for my parents, even though the parents will tell them smoking's bad, don't do it, you know that the likelihood that those individuals are going to smoke or vape is much higher.
I don't know a lot about vaping other than I read that it's out there. Why has that become so widespread? Do we understand the phenomenon? What is there about sucking something into your lungs that is so satisfying?
Well, I think that vaping, when it first came out, and I don't pretend to be an expert on vaping either, but when it first came out, the idea was, gee whiz, it was portrayed as an alternative to smoking and perhaps a safer alternative that still satisfied your craving because the vaping vapor contains nicotine, of course. So for an adult smoker who wants to quit and hasn't been able just to quit cold turkey, it was a method to be able to perhaps segue off of cigarettes. The same idea, for example, as a nicotine patch or a nicotine gum. And unfortunately, there's some people who forever, once they quit smoking cigarettes, are on the gum or on the patch.
Yeah, it's
Perhaps
a very
better.
addictive substance.
Very addictive substance. And the idea
And the lung is a very effective way. It's effective delivery system too, from what I understand.
It's a very efficient delivery system. So it was portrayed initially as something that was safer than cigarettes, and the kids figured, well, if it's safe, and if I could do it in school and not leave a trail of smoke, maybe nobody will be able to find out about it. So that's one simple, overly simplified reason why it caught on in popularity.
And not to tread too far into a controversial area, but how about marijuana smoke? I've read different evaluations on that. Is that a segue to regular smoking? Is that smoke dangerous to you? Or is it the solution to everything, as some people will say?
Well, I think part of the issue with marijuana smoke, there's nothing safe about it, but I don't think the overwhelming majority of people who smoke marijuana are going to smoke it in the quantity that you would smoke 20 cigarettes, which is a pack of cigarettes. So even if it's dangerous, and the same can be said of cigar smoking, it's a quantity issue that while it's not good for you, because the quantity is going to be much lower, you probably won't be doing yourself as much danger. That's not to say I advocate either of those, but safer.
Okay, and let's go on to exercise. I know why that's so difficult, but go ahead.
Well, exercise is another one of these behavioral things. And during this COVID epidemic, it's been particularly problematic in that even people who like to exercise, with the gyms having been closed until recently, people are looking for sometimes a reason why they don't exercise. So the weather's been warm, but the gyms are closed. So it would seem to me this is an opportunity to perhaps pick a different form of exercise. Maybe you want to go outside, maybe you want to walk, maybe you want to bicycle. But there are many people that I see in clinical practice who I'll ask them, are you exercising? No, my gym closed, so I'm not exercising. And I suggest maybe they consider an alternative way of exercising in the same way that I do when in the middle of the winter I say, do you exercise? And they said, no, it's cold. And I say, well, you either need to go indoors somewhere and exercise or perhaps move to Florida. So people who want to exercise are going to find a way to do it, and people who don't really want to exercise can find an excuse. And in this COVID era, it's a little bit easier with the gyms closed not to exercise.
And I know that exercise doesn't necessarily have to be an hour at the gym 7 days a week. It can be climbing the stairs to your office rather than taking the elevator. You know, lots of ways to just increase your daily activity.
That's right, and I think the government and the experts have become a little bit more understanding of that issue. At the end of the day, you can count up your steps. If you carry an iPhone, for example, it counts your steps. It's an easy way to do it. But the government and the Heart Association recommend, if you're going to exercise, 150 minutes of moderate exercise a week. So you can break that up into 30-minute groups 5 days a week, but it can also be a few minutes of stair climbing here and a few more minutes there, maybe a 15-minute walk at the end of the day. It all adds up and is cumulative, but it does have to do with habits.
Yeah, and as you said, it can't be, well, we're going to talk about diet next. I mean, it's like going on a crash diet. You know, don't go from 0 to 60 and expect to be able to sustain it. It's something you have to build into your everyday life.
Right.
Now, it's the odd thing that we're seeing is our society is also becoming more obese. As the more we talk about staying thin, my own theory is some of that has to do with our decreased use of smoking, but it's also the kinds of foods, the advertising. What do you think about all that? Are there any solutions to that?
Well, again, not to be a wise guy, because we keep coming back to the same thing, but the theme has to do with behavior. And obesity is an epidemic. And by the American Medical Association, obesity is no longer just a symptom, it's a disease all by itself. And whatever other issues you have with your health, obesity is an independent predictor of developing outcomes that are bad, for example, heart attacks. So obesity is a problem. It has to do with children who are doing more, you've heard this before, you know this, and your audience does too, staying home, watching more videos, eating more fast foods, triglyceride or simple carbohydrate-laden foods, things that are supersized in terms of what you buy, whether it's sodas, candy bars, everything else. So this is, again, a behavioral issue, and it's a huge issue. My own cynical belief here, and I certainly hope I'm wrong about this, is Americans want a solution to all of their medical problems in the form of a pill.
Oh, I could agree with you more.
Whether that's blood pressure or cholesterol, until we have a pill rather than a knife, for example, for obesity, I don't know that we're going to get control of this issue. But it's a huge, no pun intended, it's a huge issue.
No, I think one of the things that concerns me is when I watch television advertising, the number of ads for supplements, pills that are going to make you strong, make you vital, have you lose weight, fix your brain, you know, and it's all take this pill. Most of those have almost no effect at all other than a placebo effect, but it's become an enormous market. So it's clear our society is looking for a pill to fix all of their health needs.
We're looking for a quick fix for a very complex and lifelong problem. And I would suggest that at least as of now, that fix doesn't exist.
Any other things, well, other things that you would recommend to maintain a healthy heart?
Well, maintaining a healthy heart requires, in simplistic terms, two things. One is, and you've already mentioned this, sticking with a healthy lifestyle. And we always emphasize a healthy lifestyle. Even if you've, heaven forbid, had a heart attack, your recovery starts with a healthy lifestyle. We put you into an exercise program. We educate you about a better way to eat. Of course, we treat all of your so-called risk factors, but all of this business with preventive disease management starts with a healthy lifestyle, and you've mentioned what those things are. And then when you get into the specifics of, well, what about your blood pressure? And what should your blood pressure be, and how are we going to get that under control? And what about your cholesterol? And how are we going to help you, and there is help, quit your smoking habit? And how are we going to encourage you and foster a lifelong habit, that's what it's about, behavior and habits, of exercise? So it's always back to fundamentals. And I remember when my kids, I coached my boys in basketball in middle school. What they want to do at that age is they just want to scrimmage and they want to play. And I always made them stick to fundamentals. The shooting drills, the dribbling drills, and so on. They hated that, but at the end of the day, it comes down to fundamentals. And the same is true in the practice of preventive cardiology and preventive medicine. It all goes back to fundamentals.
Well, you know, it's good news and it's bad news at the same time. The good news, it's controllable, it's within our grasp to affect. The bad news is it requires lifelong habits.
That's right.
There's no magic bullet. Thank you so much. This was so useful. I really appreciate your coming on the show, and thank you for watching. Remember to send your comments and questions to us at healthtalk@newvance.org. We'll see you next time. And remember, eat well and exercise.
Our fight against coronavirus isn't over. We still have to slow the spread and do our part. Let's wear face masks in public. Stay 6 feet or more from others. Follow state and local guidelines. Wash our hands frequently and stay home when we feel safe. For ourselves, for our loved ones, for our future. Let's move forward together. Learn more at coronavirus.gov.
145 over 92.
180 over 111.
182 over 100. And I had a heart attack and a cardiac arrest, and then a stroke.
Your blood pressure numbers could change your life.
A lot of people don't understand, including myself, I didn't, now I do, the impact of having a stroke.
My memory is shot.
When I woke up, I couldn't speak.
If I would have followed a treatment plan, I would not be in this situation.
It's a tough journey.
Lowering your high blood pressure could save you from a heart attack or stroke. If you've stopped your treatment plan, restart it or talk to your doctor about creating one that works better for you. Start taking the right steps at manageyourbp.org.
It's a new life, but I'm gonna make it better. Coming back. Ask your doctor, check your blood pressure.
COVID-19 leads the news headlines in almost a daily basis. And as the pandemic has progressed, we have learned more and more about COVID-19's effects on normal health maintenance. The topic of today's Health Talk is cardiac wellness in the COVID-19 era. A cardiac physician will join us to discuss the effects of COVID-19 pandemic on the care of the uninfected cardiology patient. So please stay tuned for this very topical and important show. We're up next. Hello, I'm Dr. Eric Mazur. Today our topic is cardiac wellness in the COVID era. Our guest is Dr. Harvey Kramer. He's a cardiovascular physician with, is it still WCHN?
WCHN, Nuvance Health, however you like.
Nuvance Health up in Southbury. Pleasure to meet you, pleasure to have you on the show.
It's a pleasure to be here. Thank you for having me.
So you've been a cardiac physician, I keep saying sort of physician for a long time, and we've been living through this pandemic, and it's really changed how you and your non-COVID infected patients have interacted. Tell us about the problem. This is a sort of a subliminal, or I should say sub-rosa problem that is not discussed enough.
Yeah, I think that's right. And COVID has been an inflection point in the practice of medicine, I think for all physicians. Certainly cardiovascular physicians are no exception. Some of what we do sometimes can be a little bit more dramatic, and what's happened as a result of COVID is we've had to pivot to practicing in a new way. For example, your audience and you have heard about virtual health. So during the hotspot, the hot time of the pandemic, we were not seeing patients in person except for absolute emergencies in the hospital, for example. We would see people, for example, in an office setting, either on a telephone or on a video screen. And to a large degree, that was adequate for most patients to buy us some time. And I dare say that going forward, there will be, I would think, some of that goes on forever. So that's one of the good aspects.
Sure. So just to check in, are you taking your drugs?
That's right.
You can do a lot of that over
You can, and people say to me, well, how can you possibly do that? Well, among other things, I'm a hypertension specialist, and the overwhelming majority of my patients have had for a long time their own blood pressure machines at home. So when I call them, I can see, I can't listen to their hearts, I don't have a stethoscope, but I can ask what their blood pressures have been and actually manage their blood pressures over a telephone or over a video screen. Where the problem has come is in people who say, ooh, I'm afraid to come to an office, I'm not feeling well, I'm afraid to go to the hospital, I don't want to get COVID. And I can tell you of some anecdotes, and there's nothing unique about my practice in that regard, some anecdotes of patients who've gotten in trouble. Firstly, I've had, give or take, half a dozen individuals who were getting prepped for heart surgery, valve replacement, bypass surgeries, combinations, and so on, each of whom put off the surgery. No, I don't want to go to the hospital, and it wasn't considered emergency surgery.
So the surgery was still being offered at the hospital at this point?
Well, only really for urgent or emergent surgery.
And so, even these urgent patients were saying?
Yes, they didn't want to do it. They or their families were telling them, no, don't go to the hospital, you'll get COVID. If you go to the hospital, you're going to die. They were fearful. So of the half dozen patients who put it off, within 2 months, 3 months, 2 of the 6 had to have emergency surgery. And this is big time serious surgery. These were for valve replacement, actually. And today, as another anecdote, I saw a gentleman that I had never met until about 6 weeks ago. And we met on the phone and via video, actually, and he was having chest pain. And he'd already had a heart attack and several stents. He was having more pain. I said, you know, this is a serious condition. We really need to do more. You need to have an angiogram, meaning a catheter in the heart. We need to see what's going on. No, I don't want to go in the hospital. I won't have that. What else can you do? I said, well, I can buy us some time with some medicine. Great. I did the best I could. I saw him in the flesh for the first time today. He's having more pain. Every time he tries to do what he does outside, chop wood, do some yard work and so on, he's getting pain, has to stop for 15 minutes. So now he finally agrees to have an angiogram. He's very lucky that he didn't have a heart attack or worse during this waiting period. So that the moral of the story is waiting can be hazardous to your health.
And this is really frightening, because this is the undiscussed. I've seen it mentioned, but it's really not quantitated, it's really not emphasized, that our fears of COVID, which are quite extreme and maybe in some instances misplaced, are undermining our ability to take care of problems that we should be caring for, and maybe killing patients. You know, if your patient had a massive heart attack, he'd be dead. And that wouldn't be counted as a COVID statistic. It would just be counted as a routine death, a normal death.
That's right. And one of the things that I would emphasize, I tell patients, there's no cleaner place to go than a hospital or a medical office these days because of all of the precautions we take. After every patient, the plastic furniture, we don't even have cloth furniture anymore, it's scrubbed down, it's washed. Only one patient in the office at a time. You have to wait outside in your car. We're all wearing masks. I wear a shield in addition to the mask. My hands, I can't wait for the winter to see how chapped they are. I'm washing them what seems like 100 times a day. I clean my stethoscope with an alcohol wipe after each patient. You get the picture. It's a very safe and clean environment. So ignoring your health in terms of not coming to the hospital if necessary or not coming to the doctor's office, no longer justified.
Yeah, I believe when Governor Cuomo tested healthcare workers for COVID, evidence of COVID infection, it was lower than the population as a whole.
That's right. And we're in our heads are in the mouth of the lion, but we're taking all of the appropriate precautions and being very careful, which of course we want our patients to do, but that doesn't include ignoring follow-up of your health care.
So tell people what to do. What should they be doing right now?
What they should be doing is, if they have a routine office appointment schedule, they should keep it. And if they've skipped an appointment because of what has been over the past 6 months or so, COVID, they should call their physician and schedule a make-up appointment and make sure that all of their problems and issues are being addressed and all their treatments are up to date.
Yeah, this is really a casualty of this unprecedented event that's terrible. I've also read a lot about emotional issues that have come as a result of this that take it untold. I wonder how many people have stopped prescriptions or are not keeping up their mental health. Do you have any experience with that in your patients?
Well, I do. Needless to say, this has been a stressful time for everybody, and people should understand that stress is not something, no big deal, it'll pass, I can deal with it. I tell people that stress and anxiety are issues that if you have an IQ of 200, which makes you a super genius, you still don't have the tools to deal with. You have to learn how to deal with stress, and there are a lot of techniques out there that you can do that. But stress and anger and frustration are actually risk factors for developing heart disease and heart attacks. So this isn't something that you can ignore or that you don't want to deal with. But it is very real, the stress and anxiety that goes along with this epidemic, and it's not going away tomorrow.
I've read that a lot of cancer patients were not getting their therapies. Screening has been reduced. The other one that I read was very interesting, that the emergency rooms are not seeing their volume of cardiac patients. I'm sure it's all the same phenomenon, but incredibly destructive for patients.
It's been well documented that during the height of the pandemic, the number of people with actual strokes and heart symptoms, some of whom had heart attacks, didn't come to the emergency room. So the volume of patients who presented, or didn't present, I should say, with strokes and heart attacks was down by as much as actually over 50%. Now, some of these individuals really, they were false alarms anyway, but some people may have had heart attacks or strokes and didn't get care. And you've heard this saying before, but time is muscle when it comes to your heart, and time is brain when it comes to your brain. So you don't always get a second bite of the apple if you delay getting care and you're having acute symptoms. Please, heaven forbid if you're having those, get to your caregiver, get to the emergency.
That's such an important message, and I think even in a non-COVID era, I think people tend to minimize and say, well, you know, this will go away. I'm not having a heart attack. It's just indigestion, or you know, whatever, and they don't go see help. And as you said, today there are treatments that minimize the damage from a heart attack, minimize the damage from a stroke, and that is available at your hospital.
Absolutely, and save lives. And an extension of that, which existed before and still exists, is patients who are having a problem, instead of dialing 911 and having the real healthcare experts take them to the hospital, they drive themselves. Well, it's probably indigestion. Well, it's called heartburn for a reason. It may be more heart than burn. And if you drive yourself and heaven forbid something horrible happens on the way, you may not survive. Whereas if 911 takes you to the hospital,
right, then you have the experts right there.
Exactly, and they can save your life.
Tell us about a little bit, now you've had experience with telemedicine now with your patients. How do you think that's going to change the practice of medicine as we move to the future? Will it improve access? What are its effects going to be?
Well, I think that the long-term availability of this is going to depend on a couple of things, a few things. One is physician acceptance and healthcare system acceptance. Two is patient acceptance. Three is reimbursement, which used to be quite poor for these things, but is at least temporarily improved. And four is the technology. So the technology is good, but it could certainly be better. Some patients, for example, very elderly individuals, aren't necessarily tech savvy, and during the COVID era, in theory, their children could help them get onto a website, register, establish a password, and so on. But even their kids during the COVID era didn't want to go over to their parents' home. So we had some elderly patients who just couldn't get the hang of this, and we would revert from a video call because they couldn't connect into a simple telephone call. And that's not as good as a video call. But I think that this telemedicine is here to stay in some fashion. For example, if just for sake of discussion, I see a routine patient twice a year, maybe going forward I only need to see them once a year in the flesh, and the other time could be a virtual visit. Think of the advantages. Maybe it would be a lower cost. Maybe instead of somebody having to take time off from work and travel with all the time and expense, they could do it from work, they could do it from their home, we could have a meaningful medical interaction and still satisfy the medical needs that they have. So I think to some degree, it remains to be seen how much, telemedicine is here to stay, and the acceptance of that has really been accelerated by this COVID epidemic, pandemic.
How have you found the patient's reaction to that? Are they happy to be able to see you, or do they feel they're getting a half of a visit because you're not putting your hands on them?
Well, it depends how much effort you put into it and how good a listener you are. Because in person you can see visual cues, body cues, hand cues. You don't have all those cues on a telephone or on a video call, so you have to be a patient listener, number one. But I can tell you that in our system, Nuvance Health, they did surveys of the patients. 98% of the patients in the surveys after these telemedicine visits were ecstatic with how they went. They were delighted to be able to see a physician and have access. They were delighted not to have to go in person into the office at that time, but they were very well accepted.
Well, it's going to be really interesting to see how that plays itself out over time, and that's integrated into the practice of medicine. I'm sure in some of the rural areas it'll be a profound difference.
Absolutely.
In terms of where the travel is. That's all we have time for. That was really interesting stuff. I think the important message for people at home, and that is hospitals are safe, emergency rooms are safe. Avail yourself of the care. Unfortunately, that's all we have time for. I want to thank our guest, Dr. Harvey Kramer, for coming on today, joining us on Health Talk, and thank you for watching. Remember to send your comments and questions to us at healthtalk@nuvancehealth.org. We'll see you next time. Stay well, and don't be afraid.
Our fight against coronavirus isn't over. We still have to slow the spread and do our part. Let's wear face masks in public. Stay 6 feet or more from others. Follow state and local guidelines. Wash our hands frequently and stay home when we feel safe. For ourselves, for our loved ones, for our future. Let's move forward together. Learn more at coronavirus.gov.
Now I do. The impact of having a stroke.
My memory is shot.
When I woke up, I couldn't speak.
If I would have followed a treatment plan, I would not be in this situation.
It's a tough journey.
Lowering your high blood pressure could save you from a heart attack or stroke. If you've stopped your treatment plan, restart it or talk to your doctor about creating one that works better for you. Start taking the right steps at manageyourbp.org.
It's a new life, but I'm gonna make it better. I'm coming back. Ask your doctor, check your blood pressure.